Good morning. This is Dr. Bill Wyatt again with the American Orthodontic Society, and I'm going to talk a little bit more about these upper and lower bonded retainers. These have several uses, and this is one interesting use that you might get some information out of. And let's look at this lady right here. She's got a pretty good facial height and everything. She could smile a little more, but anyway, this was in '03, and that's the way her teeth looked. And you can see why she wasn't really smiling and showing these teeth off when they look like this. And so what we're going to do, that's in a class 1 molar relationship, looks like back here. And we're just going to close all this space up and line those teeth up and bond them together. And that's what you can do to it. Now you're going to have to hold it there because she's got a tremendous tongue pressure, and this pressure is pushing against these teeth, and it just will flare them out regardless of what you've got, unless you have them tied together really quite firm. So we bonded these teeth together and just put an upper and lower retainer in her mouth also to take part of the load. And you can see what they look like here at the end. All right, this is '03, and she's got a pretty good class 1 relationship right there. And the upper isn't too bad, and the lower is spread out, and you wonder if those teeth are going to fill the gap. But you move the teeth together to see, and if they're too small, you'll have more overjet and overbite and overjet you normally would. But if it comes out, it depends on where it's going to hit here. So we go ahead and here we've pulled the upper teeth together, and we've bonded an upper 3-to-3 retainer in here, going from cuspid to cuspid, and it's bonded pretty good. And now this was '06, and here it is '03. There's what '03 looked like on the side of the mouth. And here is the upper '03, and she's smiling here. We've got the upper in now, and I think we've got both of them in. Anyway, we came and closed the space on the lower arch, and there's the '03, and now the space is closed on the lower arch. We'll bond it together too. Come in here and show that now. All right, this is bonded, this 3-to-3, and just really bonded good, but keep space open between here so she can use dental floss now and keep the clean. Now this bond would hold, except she's got a tremendous tongue pressure. She's going to push against that. If this breaks it all, it'll push those teeth out of place. Now what we're going to do is come in and make a lower retainer and an upper retainer that would be very difficult for her to break. Now this tongue pressure will push against those retainers, and it'll move the whole dental mechanism forward here some until there's pressures pretty well equaled out. If she wears this constantly, it'll do that, because we're putting something else in there that takes up some of the room of the tongue. So the tongue can move on this, but if it moves it forward in an organized manner, you don't care. It'll be a little fuller faced, but that'll take a long time for it to do that. Now let's See here, this is O3, the upper, and there's the way the upper looks. Now we bonded this lower, we put a lower retainer in there with an acrylic base to it, and we've got a wire there. We've got it really wired up where it stays in that place. Now this tongue can push on this, and if it does, it'll push the whole thing forward. In other words, if it goes forward and it looks good, okay, it comes to some point in there that it'll come at rest, but she'll have to wear this thing for a long time. It just be a necessary thing for her. This upper retainer pad doesn't look like it fits very good, but I think it wasn't seated good in here. Where she'll hit on here, she's got this bonded retainer in there. This retainer keeps the teeth expanded in the side. That's about the only thing it does. It kind of backs up the upper teeth. So you can bond that retainer like that. So here she's got a set of teeth now that look like this, and that's good. She'll hold up pretty good like that, and I hope that she stays. But this is tough to keep. And here we are. But here's the final picture of her, and I thank you for looking at this, and I hope you get something out of it. We've jumped back to the start. Hope you enjoyed our group and subscribe to it. So I'll say goodbye and close this out. We're going to